Maisha Ni Health. Maisha Ni Health.
In today's episode, we'll be talking to people on the streets of Nakuru town. We'll also be bringing you case studies of patients who've been transferred from one hospital to another using the country's hospital referral system. Later on, we'll be hosting experts and wananchi to a town hall meeting, as well as get a view from the Ministry of Health Command Center with the Cabinet Secretary Mutahi Kagwe.
Mimi naitwa Phyllis Moses. Niko na mtoto ako hapa Kenyatta na ako na miaka 3 na miezi 11. Nilipomzaa, huyu mtoto hakulia immediately. Alikaa around 30 minutes. Na penye alianza kulia alilia masaa 2.5 bila kunyonya. Huyo mtoto hapo kitambo alikuwa yani akikula chakula haiwezi kaa kwa tumbo. Akikula hivi anaitoa. Akikula anaitoa. Maana huyo mtoto alikuwa na shida ya kupumua kabisa. Alikuwa saa zingine anapumua anasirai kabisa. Naona mimi huyo mtoto amekufa. Tukaenda tukakaa wiki moja hapa hospitali tukadischargiwa. Tukaenda tukakaa mwezi mmoja akarudiwa. Ya kwanza ilikuwa Katulani. Ya pili ilikuwa Kitui. Ndio akamwandikia referral ya huko Kenyatta. Na saa kutoka tupika hapa, huyo mtoto alikuwa mbaya. Lakini saa hizi ako na improvement kubwa sana. Maana tulipofika hapa walimpea dawa ya shida ya moyo kwa siku 5, wakampeleka huko chini, akapika picha wakasema hiyo shida sio kubwa. Tukaenda kwa mapua akaangaliwa na masikio akaangaliwa. Kutoka hapo wao walituangalia wakatuambia tumrudishe huko chini aende hiyo shida ya moyo sasa angaliwe huko. Maana hiyo shida walikuwa nasema ni kubwa. Sio shimo iko kwa moyo. Shida yake ni wanasema kuna bakteria alisaliwa nayo katika mshipa wa moyo. Na venye ikikaa bila kupewa dawa inanguruma. Ikipewa dawa inashuka. Saa iko chini. Wanapewa chakula vizuri, wanapewa yani kila chakula mtoto anataka akule wanaletewa. Kama singeletwa Kenyatta, naona huyo mtoto angekufa. Maana hiyo pesa ni mingi. Najua hapa unaweza lipiwa na NHIF, kama una kati nyingine unaweza lipiwa, lakini unajua private huwezi lipiwa na NHIF na huwezi lipiwa na ni utoe pesa yako. Hata niseme hiyo hospitali na hospitali ya kusaidia kila mtu. Maana huko tumeguzanyika watu wengi. Watu kutoka Meru, kutoka wapi, wote wako hapa na wote wanasaidika.
The story of Eunice and Josephat reflects the Kenya National Referral Infrastructure. Behind me is the Kenyatta National Hospital, which is the oldest and the largest referral hospital in East and Central Africa. KNH has been operational since 1901. This hospital has played a pivotal role, especially in the healthcare system here in Kenya. 121 years later, we are talking about this hospital sitting at the apex of the Kenya healthcare referral system. Below it are 4,700 healthcare facilities, of which are organized in a hierarchy that is based on 6 levels of care. This hierarchy forms the Kenya National Referral Strategy.
Kenya Referral System is divided from level 1 up to level 6, where level 6B, like where Kenyatta is at the apex. It's at the end of the road. When we say referral, it means you are referring a patient from a facility to another facility by the fact that there are some services that needs to be given which that level of facility does not have. So when we say Kenyatta is a referral apex level 6, it means there are services that our customers or our clients can only get here where they cannot get from the other part, from the other facilities. Secondly, it's actually a handing over system where you come, maybe we manage your condition in this level, then from there we are unable or we have a deficiency either of expertise or equipment, then we hand over. In the long run, what we want to have Kenyatta for is specialized services and even sub-specialized services. so that we only want to deal with cases that cannot be managed out there. With that, then, we want to leave Kenyatta only for specialized clinic and follow-up.
The referral system has 4 levels of service. Being at the top of the referral hierarchy means that Kenyatta National Hospital must have the highest capacity to provide specialized medical care. Kenyatta National Hospital has a bed capacity of 1,800 and attends to an annual average of 700,000 inpatient nights and 600 outpatient visits. Together with its sister facility, the KNH Othaya Annex, the 2 facilities are equipped to handle almost every case referred to them. Their diverse equipment is the best in the region, at par with the best in the world. This equipment covers a wide range of needs, including open heart surgeries, neurosurgeries, orthopedic surgeries, reconstructive surgeries, burns management, oncology, dental surgery, laboratory services, renal dialysis, chemotherapy, diagnostics, theater services, and many other specialized services.
My name is Jacob Kioko. I'm a therapy radiographer in Kenyatta National Hospital. This is the Cancer Treatment Center Radiotherapy section. This is where we do our radiotherapy for our cancer patients. After our patients have been seen in our clinics, they are referred to us for treatment. After simulation to mark up the area of interest, they are sent to us on this machine. This is a Cobalt 60 unit.
My name is Rahab Mwangi. I work in renal laboratory. This is our renal department laboratory. So here we do tests for our renal patients. We do the kidney function test for them. We do full hemogram where we check their HB before they dialyze. We also do some urinalysis for the renal patients. And this lab also works for other departments like the pediatrics and RTC. Most of our patients, most of our samples, we get them from the outpatients and inpatients, including the ICU. All the ICUs in Kenyatta National Hospital, their samples are done in this lab. So we work for the outpatients, those people coming for dialysis with renal problems and the like, and our renal ward, which is up here, plus our ICUs.
Other national referral hospitals include Kenyatta University Teaching, Referral and Research Hospital, Moi Teaching and Referral Hospital, Mathare National Teaching and Referral Hospital, and National Spinal Injury Referral Hospital. Kenyatta University Teaching, Research and Referral Hospital has in recent years been upgraded to a level 6 facility. It also houses the most advanced cancer management center in East and Central Africa, the Integrated Molecular Imaging Center.
A lot of people don't know about really the kind of work going on in level 6 hospitals, for example, like this one. And I think hopefully, Kenyans will get to know the kind of work going on here, because then they don't have to go and seek these services outside the country. So we are doing a lot to make sure that we have the best doctors here. We have some of the best equipment, and I feel personally that the government has done a lot to make sure that we reduce the medical tourism to go to other countries. So something else we are encouraging as an institution, as a hospital, is for Kenyans to be checking their health early because they even become sick. And therefore we have started what we are calling a wellness center, where Kenyans can come, and they're coming already, and they tell the doctor, just check, some of the indicators, and that way we are able to see if people have cancer early. As you know, if you are diagnosed early, and the cancer is maybe stage 1 or 2 or even earlier, then the chances of healing completely are better.
Safari yangu ni ya cancer, breast cancer, na nilikuwa referred kutoka Kisumu, Jaramogi Oginga Odinga, hadi hospitali nije kwa radiotherapy. Ingaje kufika hapo, before nifike kwa radiotherapy, niliingia kama niko na maumivu ya mgongo. So mgongo ulikuwa na maumivu, singeweza kusimama, kuketi, hata kutembea, hata nikipanda kitanda singeweza kushuka. But wakati nililetwa hapa, ilibidi nianze na MRI first, wajue hiyo mgongo shida iko wapi. Ndio nikapigwa x-ray, wakapata iko na fracture kiasi. But sasa hiyo fracture, daktari akaangalia akasema juu mfupa imekulwa na hiyo cancer cells iko weak kiasi, so nikienda theater haitaweza kunisaidia vile. So niwekwe kwa hiyo radiotherapy, hiyo inaweza zuia kiasi. Kwa saizi naweza sema matibabu iko sawa, sababu changes ziko mingi, si vile niliingia, tofauti iko, na ninatumai bado nikiendelea kuishi, bado wakati nitamaliza itakuwa vizuri zaidi. Kwa kufika wakati huu, naweza sema nikiketi wiki moja, wakiangalia hiyo palliative care ya mgongo, kuna ile bili ambayo niliandikiwa naweza nitalipa mwenyewe, na kuna ile NHIF itasimamia. So kufika wakati huu bado sijajua nitaenda kiwango gani, ndio nijue nitaweza kulipa ama nitashindwa. Hapo ndio sijajua vizuri, lakini kwa matibabu iko sawa. Nilikuwa nafanya kazi ya salon, na salon kawaida ni mgongo na kifua. So lazima usimame, ushuke customer, ukipata chenye utapata ndio utajisaidia. Lakini sasa juu mgongo iko na shida, kama haitarekebishwa ikuwe sawa, unaona maisha yangu itakuwa ishasamaratika tayari. Sitaweza kufanya hiyo kazi, na labda maybe sijafikiria kazi nyingine ya kufanya ambayo itanisaidia maishani.
We are a relatively new hospital, national hospital, level 6 as I said, and we receive patients not just even from within the country but also abroad. So our catchment area are all the 47 counties. We also have highly specialized services that are not available anywhere else in the country and also in the neighborhood countries. And so our catchment area also includes patients from those countries. The establishment of this institution has served well the universal health coverage because of the specialized services that are not available in the other level 5, in the other levels, the other lower levels. And so this institution was established to ensure that we address the gaps that are there, and by also introducing specialized services again that are not available in those other levels. So I think we are also decongesting other public institutions such as our sister hospital, Kenyatta National Hospital, and with us now again introducing more services, specialized services, it will continue to improve to support the President's initiative of the universal health coverage under the Big Four agenda.
So Maisha Ni Health continues, and today we are here at Nakuru County, where we're going to speak to the residents here if the health referral system works well for them.
I think it is working well, yeah? Because the health workers are sensitized on the issues that they need to address at their level and what they need to do and what they are not able to do to be able to refer.
Kwa hakika mtu akitolewa another hospital aletwa hapa, huduma zao ziko sawa. Kama ni ugonjwa imeshindikana huko private, wanatuma watu hapa.
The referrals I'm seeing is good because most of hospitals around are being referred to. Most patients are being referred to Nakuru.
Maisha Ni Health.
Maisha Ni Health.
Maisha Ni Health.
Thanks to the managed equipment service, the county referral hospitals have also been well equipped, thus reducing referrals upwards and bringing services closer to the people. County referral hospitals in Kenya are level 5 facilities run by county government, which act as referral points for sub-county hospitals.
The health department in Nakuru County forms the largest devolved function in the county government of Nakuru. Basically, our mandate is derived from the Constitution of Kenya 2010. where health was devolved largely, apart from the national referral hospitals, policies and standards. And therefore, basically, we carry out all health service delivery from level 1, that is the community, all the way to level 5 health services. The department is run by one county executive committee member for health. We have 2 chief officers, 3 directorates, and the other heads of department. Our health systems in Nakuru County are organized according to the Kenya Essential Package for Health, where we have level 1 to level 6 facilities, but for the county levels, we have level 1 to 5. So the level 1 consists of the community health units, level 2 dispensaries, level 3 health centers. Then we have the sub-county hospitals, which were previously called the district hospitals, and then the county referral hospital, that is level 5. So the structure is organized such that we refer to the community a lot of times, that is from level 1, and the point of referral becomes the dispensaries. But if the patient is assessed at the dispensary and needs care beyond that, we are able to mobilize ambulances that are zoned within the county to take them now to the right level. Most of the time it will either be in at level 4 or at times level 5. In a few exceptional times, we are forced to refer to the national referral hospitals, especially when, for instance, a person is involved in a road traffic accident and they get a spinal injury. We refer such a person to the National Spinal Hospital after stabilization. So a departure from the past where ambulances were domiciled in the hospitals, the Nakuru County government has instead zoned ambulances across all the 11 sub-counties, and in every ward there is an access within a few minutes. One is able to access an ambulance as need arises.
Nilikuwa nimekuja na patient from Elbakon Sub-County Hospital. Alikuwa na shida, ndio tukamrefer huku. Alikuwa na nose bleed. Sasa tulijaribu kumanage that nose bleeding, ikatushinda. So tukaona akuje huku. So after that time tuka prepare patient. First of all tulifanya first aid, then tukampea some medication, tukamprepare, tukamweka kwa ambulance na tukaanza safari. Tuko na oxygen cylinder, tuko na trauma bag, tuko na first aid kit, tuko na resuscitators, tuko na suctioning machine, na tuko na some madawa. Some other equipments hatuna hospitali yetu, like CT scan hatuna MRI, hatuna blood transfusion, so hiyo ndio inatufanyanga to refer patients.
The goal of the referral guidelines is to guide the effective management of referral services, to ensure continuity of care and effective management of the health needs of the population of Kenya. A well-functioning referral system will have the following benefits: maximize efficiency of the health system by ensuring appropriate use of health services, strengthen lower-level facilities and improve capacity for decision-making by health workers at all levels, create opportunities for balanced distribution of funds, services and human resources, promote linkages across different levels of care and between public and private entities, ensure that care is provided at the lowest possible cost. Most of the population of Kenya is rural and poor. An effective referral system will ensure health services to all people in Kenya in the following ways: coordination and standardization of referral services, continuity of care across different levels of care, cost effectiveness of health services provided to Kenyan citizens, promotion of universal coverage and equity in provision of health services, healthcare planning through performance monitoring of the referral system. Only the cases which require very specialized treatment are referred from the county referral hospital to KNH.
Definitely a lot to learn about the country's hospital referral system. We're now taking a break. When we come back, we'll be having a panel of experts to talk more about this. You're watching Maisha Ni Health.
Maisha Ni Health.
Welcome back. Time now to talk to the experts about the hospital referral system. How much do you know? And how exactly does it work? Here at Maisha Ni Health, we continue highlighting the progress and achievements of universal health coverage as envisioned in the government's Big Four agenda. It is all about access to quality and affordable healthcare for all. Now, one of the main drivers of UHC is Health Referral System. You may have heard of it or not, but what exactly is a Health Referral System and how does it play into this whole issue of UHC? Now today we come to you from the great county of Nakuru, county number 032, and we'll have the privilege of getting that question answered by our panel of experts in front of us. Let me now introduce my panelists. We're privileged on my immediate left to have Stephen Belio. He's a Quality Improvement Coordinator for Health County Government of Nakuru. Karibu sana. Next to Bwana Belio, we have Dr. Kigen Bartilol. He's the head of National Referral Services. He's also a consultant obstetrician and gynecologist. Last but not least, Dr. John Kinothia. He's a head research department at the Kenyatta National Hospital. He's also a consultant obstetrician gynecologist. Gentlemen, karibuni sana. I know pronouncing that title, obstetrician, is always a challenge, but yeah, I'll try and get it right. Now, let's start off with this whole issue of universal, health referral system. And I want to field this question directly to Dr. Bartilol because you're the head of National Referral Services. And what exactly is this animal we're calling the Health Referral System? Probably it's something we know, but we didn't even know that's what it's called at that level.
Okay. Basically, at the head of the National Referral Services, we come up with guidelines and policies on how we refer patients. So there's the referral system depending on what we call levels of service. At the levels of service, we have level 1, which is the community level. We have level 2, which is at the dispensary level. Level 3 is the health center level. Level 4 is what we used to call the sub-county. It should be level 4. Level 5 is the county referral hospital. Then we have level 6. These different levels have different levels of service. So if the community at the ground level, they have an issue that they need to sort out and they're not able to manage it, they refer it to the next system. Mm-hmm. And vice versa. If it's something that requires to go to the national level 6, you should be referred from that level 5 to level 6. This is to ease services. We don't want somebody coming from level 2 to level 6 for a service that cannot be provided at level 4. Mm-hmm. That's inconvenient. So that's basically how the referral system in Kenya generally works. And vice versa. Okay. You may be referred backwards. You get me? You got your treatment, then you go back to your dispensary for continuous treatment. This has worked very well in places like HIV, cancer treatment, diabetes, most of the NCDs. You can actually get your drug from where you can see, rather than going all the way to maybe Nakuru, and you're coming from the other corner of Nakuru. I also come from Nakuru. So that's what our referral system is.
How exactly do those two systems work? It is a devolved service, but there's a health referral system that cuts across both systems.
Basically, in Nakuru County, the Department of Health has an established referral system, right from community level, that is from the CHVs. They're able to identify a case at causal level and able to refer it to a level 1 facility, a level 2 facility. That is a dispensary level. At that level, the officers in level 2 will assess the client, whether the client requires another specialized service ahead of another level or not. If they're able to manage, then they can manage at that level. But if they are not able to manage, they refer to level 3. Because we follow the national guidelines, as Dr. Gigan has said, there are national guidelines on referral system, right, from level 1, level 2, and level 3. So it depends in each level whether they are able to manage it or not. If they are not able to manage, they refer to the next level for further management. Even at level 5, we still refer to Kenyatta National Hospital, following the guidelines that has been established, depending again on the requirement or a specialized service that is required for that client to get, for example, in KNH. So we refer. So there's a linkage between the devolved system of health and the national level.
It's very clear in terms of the referral. This cuts across all counties. So with those hubs where they are, level 5 can refer to level 6. And it's a clear guideline within the guideline. So it doesn't come in as a county function. It's just a referral system into the other county, into the national system. Remember, as much as we say health is devolved, there's still one health system in the country. So basically we're talking about how to get patients to the ultimate care that they require.
You said that there are instances where you can be referred downwards.
Yes.
And I would want to understand how and when that occurs, if at all.
Let's say you had a cancer case and you were treated in Kenyatta at the highest level of treatment. Or you had a complicated diabetic disease and you were treated at Kenyatta, but now you are controlled. Things are easy. So instead of you coming all the time to Kenyatta to get your drugs, we can refer you down.
At what point does a facility, either level 3 or level 4, bump you up to the next facility, and how does it work? Are you referred there with a letter and you're told go see Dr. So-and-so, or what happens?
Thank you very much. Basically, when you are in, for example, a level 3 facility, allow me to give an example of a mother in labor who, after laboring for some time, develops complications. There's a system in which you are supposed to be referred. One, there's a referral letter, and again, there are standby ambulances in the level 3 facilities to take you very fast with a nurse escorting you to the facility. That is the facility being referred to. So that is how you move, with a letter and also accompanying nurse. Yes.
And if at all you're referred to, then the next level of reference is obliged to take in that patient.
Yes, because we also have a communication system where before you come, you have to call. As you prepare the patient for referral, you also make a call, somebody else assists you to notify the facility receiving the patient, and you as the referral facility, you communicate. And then you start with it.
But that's
that is
it must be a very complex web of that system, the way it works, that all these facilities are able to take up issues that are coming from the lower level, referring some downwards, and it works seamlessly. How exactly does this work?
For example, there is a patient who requires emergency management at Kenyatta National Hospital, and that allows us to prepare to receive that patient. Then they will drive the patient from Nakuru to Kenyatta, and by the time they come, we are expecting, we know that this is a patient who is coming. Actually, it's something that works and it has been working. In fact, at every minute, that is something that is happening, because health is a very dynamic process.
But from a patient's perspective, because we are not experts and I may not necessarily understand whatever is ailing me, how do I get to know, understand at what level of hospital should I seek treatment, Dr. Bartelo? Do I have to go and start at level 2? Or do I have to look for a community health, a volunteer, to ask for advice on where to go next?
Actually, you may not know what you're suffering from, but if it's an emergency, I'm assuming it's an emergency, you'll go to the nearest facility to you. That's what happens in an emergency. You go to the nearest facility to you. That basic health worker there, the health worker there, will decide, is this a simple thing that I can deal with here, or do I need to refer it? Okay? So that's how the health worker at the first facility will decide where to take you.
Because Dr. Kino talks about the capacity issues and what kind of capacity and to deal with what level of ailment is Nakuru County. Let's talk about the level 5 hospital here. What capacity do we have? And are we suffering from capacity issues, lack of capacity or something like that? But what are we able to do right now as we speak? And what are we not able to, that Nakuru County has to refer someone to level 6?
Basically for Nakuru level 5, there are quite a number of services that we can offer. And as you are aware, yesterday we launched the cancer center. So we are able to manage most of the cancer cases in Nakuru County. So we also have quite a number of specialized services again in Nakuru County. So unless they need a very specialized case, then that is when we refer. And also there are guidelines to how should you refer a client. So basically that depends again on the specialist or the doctor referring the client, depending on the services that the client requires.
How do you gauge the level of capacity of health workers?
We've really tried. We have quite a number of consultants at our our level 5 facility. Mostly mental health, issues of surgery. We have specialists, actually personnel, or to deal with those issues. And the county is actually moving towards employing more specialized personnel as we go by. So actually, I can say we've really improved in terms of personnel who are specialized or offering specialized cases.
Most of the counties actually have definitely improved in terms of capacity, human resource for health capacity. Remember that as a national function is capacity building. So we are also tasked with that capacity building. So we've looked around, we've actually mapped the specialists, especially those who are working with the public sector. And if you look at the last intake for training, we're actually training the specialists we know we don't have. Rather than training, using government resources to train those we already have. So you'll see that we are looking for more specialists, oncologists, quite a number of medical oncologists nowadays for cancer. We are trying to get more of ENT people, ear, nose and throat, where we know that there are fewer. So we're actually going to the specialists where we know that they're not enough. Orthopedic, you can see them now, at least almost every county has orthopedic surgeons with high levels of fractures and borders. So actually what we're trying to do now is balancing the capacity.
If at all we're talking about level 1, level 2, level 3, level 4, level 5, then the understanding is that if I go to Asingishu, the level 5 there, and I go to Turkana, the level 5 there should be at the same level. Yes? So that issue of standardization, Dr. Kinode said yes, the capacity issues, so you may find the county referral hospital in Nakuru probably is better equipped than the county referral hospital in Kakamega. What is your office doing in as far as ensuring standardization of services and capacity across?
Ideally, actually, there are actually what you call norms and requirements for a level 4 hospital, a level 5 hospital, a level 6 hospital. There are norms. But of course, development comes with resources.
After this short break, we'll be back with questions from the audience. Welcome back. You're still watching Maisha Ni Health. Let's now get questions from members of the audience.
Niko na swali ya kwamba wakati tumeelezwa level za hospitali from level 1 kama understand level 2 to level kama sasa kuna matibabu ya level 5 na wakati tuko kwa level 5 unapata wakati mwingine unakuwa referred kwa facility ambayo si ya serikali. Kama mgonjwa wa kansa wa saratani anakuwa referred after biopsy ya kwanza, unapata amekuwa referred to Aga Khan for another kutafuta matibabu ingine ya kutolewa hiyo biopsy ambayo umetolewa kwa hospitali ya level 5 unatumwa si Kenyatta as you had told us, unatumwa kwa Aga Khan na hiyo si facility ya serikali. Unapata unalipishwa bei isiyo kama ile ya kwanza. Kwa nini unakuwa referred kwa Aga Khan facility ambayo si ya serikali badala ya ile ya serikali kama Kenyatta level 6?
What I know is that in our network of being doctors, is that what you want is best for the patient. If you find that the turnover time, I think that's been discussed it now, when another question had been asked about turnover time of specimens. The best you'd want is a fast turnover of getting that result faster. So I think probably that is a preference of the clinician who thinks the turnover space time is faster in Aga Khan than in the government hospital. And that is allowed, we are allowed to refer across. Yeah. Even sometimes you can, even patient's choice, sometimes they refer. You can see a patient telling you, tell them you want to go to Kenyatta, they'll tell you, I'd rather go to Tenwek. I'd rather go to, like Nakuru, the referral places are, I think, Tenwek, St. Mary's. Yeah, people would sometimes also have preference of where they'd want to go.
The problem we have that some of us have encountered is that level 5, in big level 5 hospitals like Nakuru and some other counties, you find that the ambulance that's there for referral purposes is just one. And in a normal day, you can have even 3 referrals that's either going to MTRH or Kenyatta. What was in conjunction the UHC county governments and county governments and in general the Ministry of Health have done to ensure this crisis have been combated? That's my question.
Thank you very much. Nakuru County has a total of around 24 ambulances that are spread across the county. And our major issue is actually to have a quality service, to ensure that you're referred at the right time to the right place and ensure that all the domains of quality of care are adhered to. Ambulances are managed centrally in one dispatch center, so because sometimes they can, one facility can have several referrals. So we are able to manage it at one dispatch center to be able to send those ambulances to, because an emergency occurs without planning, isn't it? So we manage the ambulances centrally. So when there is a need, for example, in facility A, for 3 or 4 ambulances, we send the other ambulances there. We cannot just rely on that ambulance there. So we have one dispatch center and one transport officer for the whole county, who actually coordinates all the ambulances to ensure that if ambulance A is required in facility X, and the one in X has gone to Kenyatta, then another nearby ambulance is sent there to pick the patient, because it cannot be possible to have ambulances, spreading on the facilities.
Mimi ni mwendeshaji wa bodaboda hapa Nakuru County, na upande wetu mara mingi tunapatana na ajali. Kila siku tunapata ajali mingi sana kwa watu wa bodaboda. Sasa kama serikali ya hapa kwetu na madaktari wetu, sijui hii upande wa NHF, sijui mnaweza tusaidia aje, kwa maana watu wetu wengi wakipata accident wakienda pale tunabaki na mzigo sana huku nyumbani, na tumerealize yenye hata kuweka hiyo pesa ya NHF inakuwa ni ngumu. Sijui mtatusaidia aje.
NHF is 6,000 per year. That's 500 per month for the super cover. Get you guys, just come together, get a cover. It means a lot. The government of Kenya has been trying to make sure people get insured, and that's the reason we know why. If you've been in any family whereby a cancer or something comes into you and you don't have an insurance, you know the pinch. It can actually take down resources in a family, pack everything yourself. So me, I just encourage, if you can, you're in organized groups, one of the things you'll do is do an NHIF, as you do your other things, the chamas, the banks and all that. So if it's a group of bodabodas, you can actually get an NHIF cover, which will cover you adequately.
Time now for another break. When we come back, we'll get to hear from the Ministry of Health Command Center with the Cabinet Secretary.
Maisha Ni Health.
Thank you for staying tuned. Let's now get to hear what the CS Ministry of Health has to say.
National Referral Health System has undergone tremendous transformation in the last decade. Among the Big Four agenda by President Uhuru Kenyatta is prioritizing equitable, affordable, and quality care services, renewed impetus in the healthcare story. The discourse from the audience in Nakuru paints a picture of some of the challenges that we have faced over the years, and we do not, as a ministry, wish to bury our heads into the ground like the proverbial ostrich. As a ministry, we have taken deliberate steps to cure these challenges. I'm on record stating that the universal health coverage is not a destination, it is a journey. And the journey to fix the national health referral system is ongoing. We are focusing on increasing services at lower level facilities to break the chain of self-referrals to national referral facilities, which contribute to the congestion that the three contributors alluded to. In recent months, we have constructed new health facilities across the entire country to answer to the question of access to health. For instance, in Nairobi, we have built 19 new hospitals, revived another 6 of them to make 25 new both level 3 and level 4 hospitals to ease the congestion at the county referral facilities. Which means then that the referral facility, Kenyatta National Hospital, can be freed from a walk-in business that create, again, the congestion that we refer to. We are also educating Kenyans, and we have to first seek primary healthcare services at the lower level facilities. That's how our referral system works. The chain of referral begins at the community level with healthcare workers and community health volunteers. We are encouraging Kenyans to visit your local dispensary or a health center before you seek the services at a level 4 or a level 5 facility. The other initiatives in place are partnership with county governments to have a functional referral system as well as encourage cross-county referrals. We have also invested in low-cost diagnostic centers providing screening and treatment for people with chronic or terminal conditions such as cancer. Our long-term plan is investment in promotive and preventive health services to avert curative and rehabilitative cases that often end up at the level 6 hospitals. An old adage recognizes that an ounce of prevention is worth a pound of cure. Hence our call to focus on preventive solutions. Remember, Maisha Ni Health. Protect your health and promote your life.
I believe you now have an idea about the hospital referral system and how it can work for you. Join us next week, same time, for yet another informative edition of Maisha Ni Health as we talk about blood transfusion from Makueni County. I've been your host, Fred Indimuli.
Hapa chini tuko sawa, lakini tunajua haya, siku moja ugonjwa utakamu na ikizidi itabidi tupande lada kwa ile hosi ya sub county, na wakishindwa watuelekeze county. God forbid county ishindwe, watupeleke level 6. Bora chukue masaa 6, kwa sababu ukiwa msik mambo hutana sticky. Si vako nani, ichukulie NHIF yako.
Maisha Ni Health. Maisha Ni Health.